next speaker is Dr. Vaisha Vagat. She will be telling on clinical analysis of ocular injuries in school-going children. Vaisha, please.
Good morning, everyone. Good morning, everyone. My topic is clinical analysis of the ocular injuries in the school-going children. Ocular trauma is a major cause of the preventable monocular blindness in the world. It accounts for 8 to 14% of the total injuries in the children. An ocular trauma leads to the visual impairment, cosmetic problem, and is associated with the psychosocial problem. Most of the ocular trauma is preventable by simple measures, literacy, and awareness. Visual loss due to the trauma is irreversible, and hence prevention of trauma is of paramount importance. Aim of the study was to identify the cause, demographic, and the clinical profile of ocular injuries in school-going children, to evaluate the final visual outcome, to explore the possibilities of the prevention of the visual loss. It is a prospective analytical study. Sample size was 60, was done from December 2022 to May 2023, was conducted in school-going children of the age group of 5 to 18 years. Inclusion criteria were 5 to 18 years of age. Boys and girls were included in the study. Unilateral and bilateral involvement on all modes of injury was included. Exclusion criteria was less than 5 years old, more than 18 years, pre-existing ocular morbidity, congenital anomalies. Detailed workup was done of the patient with ocular trauma, which included a detailed trauma history, pre-existing ocular and the medical disease, visual acuity, complete ophthalmological examination, and radiological investigations. Results were seen that most of the age group involved was 11 to 15 years, which were 13 number. Boys were mostly involved, almost 47. And the mode of injury, out of 60 cases, accidental fall was the most common cause of the injury. 20 cases were recorded, almost 33.3%. Eyes involved were almost equally involved. Ocular involvement, out of the 60 patients, most ocular manifestation was lid involvement. Almost 53 patients were seen. In the study of the 60 cases, 24 has periorbital edema, 27 has periorbital ecchymosis. The most common ocular manifestation is periorbital ecchymosis followed by periorbital edema. Out of 60 patients, subconjunctival hemorrhage was mostly seen in 40 patients. Cornea involvement epithelial defect was seen in 6 patients. Scleral tear was seen in 2 patients, and anterior chamber reaction was seen in 5 patients. Pupillary RAPD was seen in 4 patients. Traumatic cataract in 1. Posterior segment involved in 3 patients. Cranial lumps, 4 optic nerve involvement was seen in the orbital. Lateral wall fracture was seen in the 4 patients. Type of injury, mostly closed crop injury was seen. Vision at the presentation, out of the 60 cases, 18 presented with visual acuity of 6 by 6, 21 between 6:9 to 6:12, and 8 in 6:18 to 6:36, and 6 were 6:60 to 1:6, and 1 is close to phase. 5 had a PL, and the 1 has a no PL. Visual outcome was seen that out of 60 patients, 39 had visual acuity of 6 by 6, 9 has 6:9 to 6:12, 2 had between 6:18 to 6:36, and 4 had between 6:60 to 1 by 60, and 1 had finger counting close to phase, 3 had PL present, and 3 no perception of light was seen. Discussion was seen that 11 to 15 years were the most commonly age group involved. Boys were mostly involved. Accidental fall injury was the most common cause of the injury. Unilateral involvement was more common than the bilateral involvement. The most common ocular manifestation was lid involvement, followed by conjunctival injuries. Closed globe injury was mostly seen. The final visual outcome of no perception of light of more common seen in the road traffic accidents. Coming to the conclusion, ocular trauma is a leading cause of the ocular blindness in the world today. It is causes a lifetime disability in the children. Education to the parents and students about watchful inactivity, importance of supervised play, and the road safety measures is very critical. Appropriate ocular protection and the adult supervision for children must be stressed, especially when using the sharp object. Prevention of accident and the early detection and management can prevent visual disability.
Please conclude. Yeah.
Yes.
It's working, sir.
Mobile.
What is your research
feedback?
Sir, in my study,
Your study, because I really didn't get any what exactly you are trying to study. You are taken as you are saying as school going children.
Yes, sir.
Nothing with the school going aspect to the study, number 1. It's just the age group between 5 to 18.
yes, sir.
Okay. So basically, and you have included starting from subconjunctival hemorrhage to traumatic optic neuropathy. Such a wide, almost everything in the ocular trauma book you have included.
Yes.
So how can you actually stratify the data and give a conclusion? And you have never introduced the element of at least the terminologies like the most common Birmingham's terminology that bets we have. So like, for example, if you are studying closed globe injuries, you are studying, IOFPs, if you are studying, ruptures, then there is an element of analysis and interpretation. But this is a very diverse, absolutely unrelated, group. And how can you come to what exactly what you are trying? What is your research question in this study?
So in my study, I have seen that mostly 11 to 14 years were involved, in which
What do you want to study?
the most common cause, what was the cause of, yes, sir.
Question. What is your research question?
So clinical analysis, that is to see the demographic profile and what were the causes. And I have seen that mostly it was the sports activity or the physical activity in the schools that led to the trauma mostly seen in that age group.
Mean your physical education period was the cause of trauma?
So physical activity
Then
like
you should take it
sports.
out from the school.
Yeah,
sports
one more
activity
thing
or
is
the
that you said that the age from 5 to 18, 18 do they stay in the school? And number two, probably she means that, so because there are a lot of lead injury cases, so an ocular plastic surgeon should be posted in the school. Is that right? Because they are most common one. So if any eye specialist of any subspecialty, and it should be oculoplastic rather than the vitreoretinal surgeon. Anyway, any more question? Yeah.
You said it's a prospective study. How did you make the prospective study? Matlab, you have followed up the cases or like that?
Of almost 3 months I have followed just.
Or you did it better, it was a retrospective study maybe? What do you think?
No ma'am, it's just a perspective because
Okay.
It's a one-time study.
yes sir. So I have done the follow-up up to 3 weeks in a 1 week, and according to the severity it was followed by 1 week and followed by 1 week and then after 1 month.
You said the second most common cause of injury was injury with sticks. What does that mean? Matlab, stick related injury in the school?
So children are playing with the sticks and
With the stick, and the school should be penalized, not the students, if they have access to that. What we are saying is commonest in the younger age group is actually pencil related sharp object. That is the commonest cause of trauma. I don't know, your data is going in a totally different direction. Commonest in the school is the pencils injury, lead pencil.
I mean, do you mean that the injuries happen during the school hours?
Or
What you are trying to say, or it is
even outside the school.
so
the injuries happen during the school hours?
Or outside the school also. That's what sir is asking.
so outside the school hours were also included.
Road
in the
traffic
study.
accidents tha na.
Sure, thank you, Varsha.